It's interesting to think about some of the societal aspects that have changed during pandemics or during epidemics. I think we can all think about COVID-19 and how social distancing has entered our vocabulary, how you kind of give people the side eye when they're not wearing a mask. You go to a place where they don't need masks and you're like, oh my gosh, I can see people's faces and it's super weird. What kind of changes happened to society during the plague and because of the plague, especially the Black Death? So during the plague, as I mentioned before, we did see that fear of people who were different. And we see that now with COVID too. There's a lot of anti Asian hate crimes going on because, well, it came from China, so we have to be horrible to Asian people. But that's not how infectious diseases work. Just because somebody is a different race from you or a different religion from you does not mean they are responsible for a disease. But that's how people behaved during the 1300s, and that's how some really ignorant people behave now. So hopefully one of the messages you'll get from this class is that microbes don't care about where you're from or what you believe. Microbes that are causing disease simply want to cause disease, and they'll find a way to do it no matter what. One of the other dichotomies that was present in society during the plague was turning to religion, like I mentioned. So some people really just, extreme prayer to hopefully protect them or cure their family, versus the attitude of eat, drink, and be merry, for tomorrow we may die. So it's like the 1300s equivalent of YOLO, right? You only live once, so plague, no plague, whatever. Gonna die anyway, let's do it. After the plague, there were some really significant changes to society. There were labor shortages. These types of infections, like plague, really hit poor people the hardest because poor people lived in the most unsanitary conditions. They lived closest to one another. They were more likely to encounter rodents and fleas. So there were lots of deaths of the quote-unquote common folk. And because of that, the lords, the people who were property owners, had to improve working conditions because now it was a situation where there are lots of jobs but not enough people, and you want to get the best people possible, so you have to improve your working conditions. There was also decreased church attendance. Overall, more of an increase in distrust of religion because religion didn't seem to help. We prayed and we still got sick and our families still died. And the differences in these types of responses really led to things like the end of feudalism, this idea that, at least in Europe, rich people could basically kind of take over a town and force all the poor people to work for them. Because the poor were able to revolt over the treatment by the wealthy. In modern times, we still have plague. Cases of plague, of course, are far fewer than they used to be. But there's one dot in each country that reported plague from 2013 to 2018. And you see the size of the dot corresponds to the number of cases. So the US, there were between 11 and 100 cases. You've got a couple in different countries in South America, some in Africa. There was a huge outbreak of plague in Madagascar, over 1,000 people. Russia, Mongolia, China, etc. In the US, we do have plague. It's not terribly common. It tends to be isolated, for the most part, west of the Rockies. There was a case in Chicago, but that was a laboratory infection. But we do have plague, I wouldn't say even annually, but maybe every few years that pops up even in the Sierra. So what do we do now for patients who have plague? Well, one, they would be hospitalized. and usually isolated, especially if they've developed pneumonic plague, because we wouldn't want that to spread. We will perform a lot of laboratory tests. We'll look at the blood, we'll look at the lymph nodes, sputum samples to try to grow the bacteria or look for the bacteria in these tissues and samples. And of course, antibiotic treatment is going to be started. Antibiotics generally are pretty effective against plague, so antibiotic therapy is the first treatment that a patient will get. Any patient who has been in close contact with someone who has the plague should be identified and evaluated, and perhaps isolated if necessary. And in the US, it is required that all cases of plague are immediately reported to local, state, and health departments, and that the diagnosis be confirmed by the Centers for Disease Control and Prevention. So plague is considered to be a reportable illness in the US, and it is mandatory to report that. In the United States, the last urban plague epidemic happened in the 1920s, so almost 100 years ago in Los Angeles. But more recently, there was that laboratory-acquired infection I told you about, pneumonic plague contracted from a mountain lion carcass. This is a little bit of older data, from all the way only till 2010, but there was, in the early 80s, an outbreak in prairie dogs and rock squirrels, which led to a huge peak in the number of human cases. But you can see that every year it ranges from, maybe 2 to 3 up to 20 or so cases of plague in the US per year. These are headlines that I found from even a couple years ago. Another person dies of plague in Colorado. This was from Yosemite. Yosemite National Park campground to be closed while officials try to wipe out plague. Utah resident dies of plague. Plague is back. How to protect yourself. So what are our risk factors? Anyone who lives in rural or non-urban environments. At least in the United States, we've been pretty good about breaking that urban life cycle of plague. Mostly because we are usually pretty diligent about keeping rodents outside of our homes. We don't want mice and rats in our homes. We do a good job about keeping them out. So instead, in the US now, the risk factor is being accidentally involved in the sylvatic or natural cycle. Any sort of contact with sick animals, wilderness activities, flea bite, if there's been plague in the community, people who work as veterinarians, and of course during the summer months when both the fleas and the rodent hosts are active. So I don't mean to scare you, but plague is around. It is possible to get. People in California have gotten plague within the past few years. So it's just important to be proactive about protecting yourself if you are engaged, especially in any sort of wilderness activities.